Today, we are going to talk about GLP1 receptor agonist, aka the famous weight loss medications. Okay. Now, I am going to approach this, or I'm going to specifically focus on athletes in this segment, right? Because I do notice a lot of athletes showing interest in wanting to be on these GLP1 receptor agonists. But here's the thing that you should note before you take a deep dive into this, right? You should note a lot of the weight loss that you would experience from these GLP1 receptor agonists can be in the form of lean muscle mass and not just fat loss. Why is that important, right? When you begin to lose muscle mass as an athlete, that can essentially disrupt your overall performance. It doesn't matter what industry you are in as an athlete. Why? Because studies have shown that these GLP1 receptor agonists can lead to chronic muscle loss, which then can lead to you having a decreased metabolic rate. And as a result of this, it would increase your risk of injury because you lack muscle support. Okay? And let's not forget the fact that your bone density would also be affected as a result of this, which would further decrease your overall performance when you are performing on the field, on the court, or wherever. So as an athlete, if you are deciding to still move forward with these GLP-1 receptor agonists, it's imperative that you prioritize your daily protein intake. It's also imperative that you do resistance training, you do activities that would allow you to build that muscle mass. It's important that you are monitoring your bone density. It's important that you are also consulting your healthcare providers, especially your nutritionist, and that there is medication monitoring going on. That's where I come in, right? As a pharmacist, and also your primary healthcare provider can help to monitor the medications that you're on as well. Overall, do I recommend athletes to be on GLP-1 receptor agonists? Absolutely not. I do not recommend it. No way, no shape, no form. But if you are deciding to move forward, as I mentioned before, just make sure you're aware of the risk, weigh the pros and cons, and make sure your healthcare providers are heavily involved in your treatment. Keep in mind that losing weight without muscle preservation can indeed compromise your athletic performance and lead to overall long-term healthcare complications.